Hydronephrosis is the stretching or dilation of the part of the kidney where urine collects. It is the most common anomaly found in the fetus from a urological perspective, and it can actually be found in up to 5% of all pregnancies. I want to emphasize that prenatally it's a finding, and the diagnosis causing this finding won't be known until after the baby is born. It can be caused by a variety of processes. The most common processes involve a blockage of the urinary tract, somewhere between the kidney and the bladder. Most commonly, this blockage occurs right where the ureter joins the kidney, the so-called ureteral-pelvic junction. Hydronephrosis can also be caused by a reflux of urine, which is called vesicoureteral reflux, and that describes a sort of backwashing of urine from the bladder to the kidney. A variety of other less common processes can cause hydronephrosis. These are important to consider, and they may include ectopic ureters, which are ureters that empty outside of the bladder. It can also be caused by a ureterocele, which is a balloon-like dilation of the ureter when it enters the bladder. It can also be caused by an abnormal tissue in the posterior urethra of boys, and this is called posterior urethral valves. Typically, prenatal hydronephrosis is picked up on a routine ultrasound study. It can be classified, it's normally classified as mild, moderate, or severe, and it can be found in one kidney or in both. Based on the classification of using these classification schemes, your pediatric urologist will have some idea, at least some clue, as to perhaps what the postnatal diagnosis will be. But once again, that won't be known until after the baby is born. Before birth, surgery for hydronephrosis is extremely rare, and is only considered in cases where the life of the fetus would be deemed at risk. This scenario usually involves a markedly diminished amniotic fluid, so-called oligohydramnios, and it's most commonly caused by an obstruction of the urinary tract at the level of the urethra. And I touched on this earlier. Most commonly, this is caused by posterior urethral valves in boys. In those cases, fetal intervention can be considered in select cases and would involve the placement of a shunt or a tube that would connect the fetal bladder to the amniotic space and thereby decompress the bladder and the kidneys. But I want to emphasize that that situation is rare and that fetal surgery is rare for hydronephrosis. In the postnatal life, surgery early on is also very rare. Most things that do require surgery will certainly wait months, if not years, and in general, the chances of needing surgery increase with increasing severity of hydronephrosis. Again, all this needs to be elucidated in the postnatal period, and won't be known until at least the first evaluation, and perhaps later on in life when all the factors can be considered together. I think perhaps the most important thing is that most cases of prenatal hydronephrosis are not serious, in that the rest of the pregnancy shouldn't be affected. Most cases will be followed by serial ultrasound studies that are performed through the rest of the pregnancy, but most cases don't impact a pregnancy at all, shouldn't impact the remainder of your pregnancy, and once again, everything can wait until after the baby is born, where we can make a diagnosis.